Dr. Amitabh Ghosh is passionate about helping patients recover from mental illnesses. His area of interest are patients with depression and anxiety, although he treats all type of mental illnesses, both in adults and children. His goal of treatment is not only to relieve the patient of symptoms, but also help him or her to function efficiently in all areas of life. We are so excited to have you. Welcome to the show.
So thank you very much. Thank you for having me here. And mental health is very close to my heart. I started off when I was doing my MBBS. So I didn't never thought that I'll do mental health, or psychiatry. I was, we'll do surgery and medicine and this and that. And we have internship and we went to the psychiatry ward. I went to the psychiatry ward in the post. I had a posting in the psychiatry ward. And I just thought this is for me.
Wow, that's
And that's how I chose to become a psychiatrist. And down the line, when I was practicing psychiatry, I realized only medicines is not enough, for mental health patients. And that's the time I started learning various kinds of therapy. And I found that a lot of mental illnesses, has its roots in childhood trauma. So that's how I got into trauma.
Right. That's why today we've chosen the topic childhood trauma with you. So like you mentioned, it's our early years of our life that defines who we become.
Yes.
And the conversation I had with you clearly depicts that childhood is very important and the traumas that happen kind of pave the path ahead. So in your years of practice, which significant changes have you observed in our understanding of childhood trauma?
In the early years of mental health, we just treated the symptoms. When someone came with a mental illness, we just treated the symptoms. But down the line, trauma is not a very old stuff. It just came up, like this 1980s, 1970s, late 1970s. We found out that a lot of stuff that's happening now, are getting triggered for what happened in the past. So we are actually hijacked into our past. You got that?
Right.
So now when we know that a lot of trauma in the past is responsible for depression, anxiety now, just treating them with medications is not enough.
Yeah, because that medication is treating the present
Yes,
and not
exactly.
the deep-rooted causes from the
Yes.
childhood.
According to me, medications helps with the symptoms, and then you're just hoping, things get better, the person gets some sort of a support, right, and come out of it. But when we address the issues, in the childhood, the root causes which cause this depression, anxiety, borderline personality disorders, and many others, the patient can recover. For my lot of patients, they are out of medications.
That's amazing.
Yeah.
So tell us, how would you define childhood trauma for our listeners who might be unfamiliar with the concept? Can you explain, what exactly is
So
it?
let me tell you what's trauma. Okay. So any incident which causes a negative emotions like fear, anger, sadness, and at that time the person is overwhelmed, okay, and it feels out of control, feels helpless. So when such incidents causes this, then we call that a trauma. Now in childhood, the brain is not developed, the frontal brain is not developed, so the child can't process it, right? So when the child can't process it, the trauma is more severe. For example, if an event happens to a child, say 5 years old, he or she will be more traumatized than someone who faces the same events at 15 years old.
Correct.
You got that?
Yeah.
So that's how childhood trauma, has its imprint, on the brain.
Also, I think what I also understand from what you said is that feeling of helplessness, I think, leads to trauma at any age. But obviously at 5 or 6 or any very young age, you anyways haven't developed enough to take care of yourself.
Exactly.
So fear and anxiety is far more, because who will protect you?
Yes. So, they feel unsupported, they feel,
Unsafe.
Okay. And this experience of the event, they are stored in the brain. They are stored in the brain in fragments. And later on, when we are in a situation, our brain is scanning, okay, scanning the situation for any kind of threat. Now, when they're scanning and they see, oh my God, there are 2 or 3 things for which I have data, right? Immediately the brain says there is a threat.
Correct.
And our sympathetic nervous system gets activated. The amygdala gets activated and says, "Oh my God, there's a threat, and you have to be careful."
Right. So, what are some of the common misconceptions about trauma that you encounter in your practice?
Misconceptions about trauma is like, people think, see, one thing is people say, "Oh, it happened in the past, but it doesn't bother me now."
Yeah, that's quite common.
Yeah, it doesn't bother me. I mean, I've gone over it.
I don't care.
I don't care, okay? No, it's not true. The experience is stored. Like, I don't care or it doesn't bother me anymore is because we have developed a defense mechanism.
Correct.
A mechanism to not get affected by that incident.
Or sometimes it's denial.
Yeah, denial is a defense mechanism.
Correct.
Denial, the repression, regression, okay, rationalization, lot of stuff. So, because of that, we say it doesn't bother us. But it can get triggered at any moment.
And the fact that I think you remember it and you're talking about it, it affects you in some way.
Exactly.
You're just
Exactly.
in.
See, I'll give you an example. You see, so there was this lady, obviously I can't tell you the name. She was a doctor, right? She is a doctor, okay? And she has a lot of anxiety, when she feels pressure of performance, right? What happened was in her childhood. Her parents wanted her to come first in class, be the best in piano, be the best in dance, okay, play amazing tennis. So there was a lot of pressure. And the child was trying to cope up with it, okay? Her father one day said, when I saw you won that trophy in tennis, I felt like a celebrity, you made me proud. Now the child's job is now to make the parents proud.
Yeah, because that becomes the goal.
Yeah, that becomes the goal, to make my parents proud.
That
Because
feeling again.
To make the parents happy, because the child needs the parents for their support.
Correct.
So the child, takes all that. But with time, when the child becomes an adult, there are a lot of pressures, lot of stresses, and they are still carrying that,
Yeah, that burden of making that happen.
I have to make others happy. I have to make my parents happy. I have to live up to a standard, And they actually, with that pressure, they actually can't perform.
And this is also a sort of trauma.
Of course, pressure of performance is a trauma.
Right. How interesting, because I don't think our listeners, or even I honestly did not think that would be a trauma, but that's very interesting to know, because coming from the society, I think it's a cultural thing. We as kids were pressured, to perform and be a certain way, and I think we are still carrying it with us.
Yeah. You see, it's not that pressure is bad. It's like a toothpaste. Okay, let me give you an example. So if you press a toothpaste, you don't press, nothing comes out. Yeah. So you have to give some amount of pressure.
Correct.
If you give a lot of pressure, everything comes out.
Yeah, true.
So you have to know how much pressure to give
right
to
balance.
A child. The balance. How much pressure to give to a child. So enough, it's like the child can perform well.
I think that's interesting. Also, I think back in the day, the previous generation, let's say our parental generation, which must be between 60 and 80 now, they did not have this kind of awareness. But I think parents today, which is, I feel like between 30 and 50, they are kind of aware. And I think they can make themselves aware, which is why, this is a great topic I wanted to touch today, because we might not realize that we might be building trauma even for our children. There is one, that we are fixing our childhood trauma, but the second aspect is, let's not build the childhood trauma for the next generation.
That's the idea.
Yeah.
If you are trauma informed, if you understand trauma, it's not only you heal yourself, you help the next generation.
Correct, absolutely. So can you explain the difference between acute trauma, like a natural disaster, versus chronic trauma? Yeah.
So chronic trauma, as the name says, it goes on. For example, the child is beaten up for studies, slapped, by the mom, for example, off and on. When the child says he has to study, if he does a mistake, the child is slapped, okay? And that goes on for a long time, okay? Now what happens to this child? The child develops fear of making mistakes, fear of failure, right? The child wants to be perfect. So that the child doesn't get slapped, the child is always trying to be perfect, right? So now when they grow older, they're carrying this, be perfect. You can't make mistakes.
And they're always living under pressure.
There's a pressure. Yeah. Okay. So, if you are trying to do something, Yeah, when something is going on for a long time.
Right. It becomes a habit, becomes a part of your being.
Yeah, so like in trauma, we say like it's a big T and a small t. You understand? So big T is an acute trauma, like a natural disaster, or a rape or something, or an accident. But the small T's, many small T's over a period of time, that's chronic trauma. Yeah.
So, acute trauma, can you explain what kind of traumas contribute to acute
It
traumas?
can be anything. It can be like PTSD. Somebody met with an accident. Okay,
Right.
that can be a acute trauma, or somebody like was sexually abused. That can be acute trauma.
The one-time huge event.
One time huge event.
Yeah, that changes and scars you in some way.
But chronic goes on for a long time,
Got it.
time.
That's very interesting. So, like you said, trauma is childhood based. What's most important in our childhood is our caregivers. Would it be parents, grandparents, foster parents, neighbors, whoever's looking after you, whoever's the main caregiver.
Even teachers.
Even teachers, whoever's your main caregiver kind of becomes responsible for how you shape up and would be responsible for the traumas that you have. So I think the role of caregivers is the most important in our childhood. Would you say so?
Of course, 100%.
So then can you tell us, how do caregivers' responses to traumatic events impact a child's ability to process trauma?
See, most of the trauma is from the caregivers.
Right.
You understand? It happens behind the doors. It happens in secret, it says. So caregivers, see, no parent is intentionally, I have to give trauma to my child.
Correct.
Okay, they don't know. They're ignorant about it, right? And that's how they were raised,
Yeah.
right?
I think a lot of it is generational.
Yeah. And say they continue the same thing, right? So for example, let's say, I'll give you an example. Let's say a child, okay? A child is trying to cross the road and holding the mom's hand, right? And the child tries to, run. And the mom holds the child and gives one slap for trying to cross the road. The mom's intention was to protect the child.
That doesn't get hurt or doesn't be an accident.
There's nothing wrong, but the child doesn't understand that. You understand? Now, when the mom slaps the child, maybe other friends who are looking at this laugh. They humiliate him. Okay, they make fun of him. And the child says, oh my God, I'm not good enough. Or my mom doesn't love me. You understand? And the child feels embarrassed.
So
This
those
can be a trauma. So what the caregiver needs to do is, after crossing the road, they need to speak to the child. Okay, you are doing this, and that's why I slapped baby, and I'm sorry. Okay, but I wanted to protect you. So the child can't process. The child's brain is not developed. The parents must process that for the child. That's important.
Explain why you said.
Say sorry if required, and help the child to express the emotions. Ask the child, okay, I slapped you over there, how did you feel about it? Okay, the child will say, I didn't feel good, I was angry. And the mother or the father needs to talk to the child. That's processing. Then it doesn't become a trauma. You got that? When the experience stays with the child, unprocessed experiences, that becomes a trauma.
Amazing.
So it's not the parents always has to be alert. Oh, I shouldn't shout at my kid or something like that. No, it's okay. You can just be who you are. But if you do something wrong and if you feel, you have to be aware. You have to be mindful, And then you have to speak to the child. That's important.
I think explain, have a conversation.
Exactly. Having a conversation with the child is important.
Yeah.
So you have to do the processing for the child.
Yeah, I think communication is the key anyway.
Exactly.
So once you communicate why you said something, if let's say a child is not studying, some kids are not into academics, and you really have to, shout or get your way through, they might think, like you said, the conclusions. But I think you have to communicate that if you don't study and if I don't tell you and you don't follow, you're not even going to make it to university. So I think that conversation may make sense years later.
Exactly. I'll tell you something. See, our brain, so it has this cognitive brain, right? Where we think and plan and analyze things. And there's a lower part of the brain, we call that the survival brain, the limbic system and all that, okay? The reptilian brain. So in the face of a threat, what happens is the cognitive part, the upper thinking part shuts.
Oh.
And what opens up is the survival brain.
Right.
So that time that child is in a survival mode. So they either trying to run away, they are anxious, or they are angry and fighting, or they freeze, You understand?
Yeah.
So that time the cognitive brain is not working. right? Now you're going on explaining the child and shouting at the child. When you're shouting and beating the child is shut. The upper brain has shut. Okay? The child is finding out ways, how can I escape this? How can I come out of this? So that time, whatever you do, the child is not going to get it.
Yeah, they won't process it.
They will not process it. Okay? They will not understand it. So according to me, beating up a child, shouting at a child, to teach the child something is nonsense. It doesn't work. You understand? You have to find other ways to teach a child other than beating up and shouting when you really want to teach the child.
Correct. So tell us, how can intergenerational trauma be transmitted through caregiving patterns?
Okay, this is a very important question. So let's say the mother or the father was beaten as a child, was abused as a child emotionally or neglected. So the parent is already depressed. You got that? The parent is already traumatized. So now this parent who is traumatized is going to bring the trauma on the child.
Which is called transgenerational trauma.
It is moving down. It's okay. Now the child will be curious. The child will be naughty. Child will explore things. Right. Okay? But let's say the mom grew up trying to be perfect. Right?
That was her trauma.
Her trauma. Like she was beaten up to be perfect. What will she do when the child tries to explore things? She will stop the child. Yeah. She will want the child to be perfect and she'll beat up the child to be perfect.
Repeat.
Okay? See, when people bring children to me, okay, depressed, anxious, and I see a lot of things are happening because of the parents, I ask the parents to go for therapy, not the child. Okay? And believe me, a lot of parents don't like it. Yeah. They say, oh, I got my child to get fixed. Why do I need to get fixed? I am from this institute and I studied in this IIM and IIT and all that. These are true stories. Yeah. The father said, but I am an IITian. What's academics got to do with this? Yeah. Right?
Parenting, love and relationships are completely different.
It's nothing to do. See, academics, you go, you study something, that's a different story.
Yeah. I think people mix up achievements and who you are. And what I've seen in my, last 18 years of my career, the more people I meet, everybody's identity has become their career. That is just what you do. It's not who you are.
Exactly.
Who you are is who you are at home, who you are with your friends, who you are with your family, who you are with your spouse. What you do is only what you do to make money and to survive in the world. But I think people mix it up. And they have identity crisis where they start to think, supposing there's a doctor. I mean, you're a doctor, but I don't mean it like that. But if somebody's a doctor, I am a doctor. That is just who they are.
Yes, and I know everything.
Yeah, I know everything, but that's your profession. Your personal and who you are is completely separate to that.
So I'll tell you a story, okay? So there was this professor when I passed my MBBS. He was very funny. He was a very nice professor. He was amazing, right? So when I passed my MBBS, I went to tell him, sir, I passed my MBBS. And he told me, oh, wow, you got the license to start studying medicine. Huh? I said, what, start studying medicine? I studied for 5 years now, and you are telling me. He said, no, a monkey can pass MBBS here. Now you have to start studying medicine. Now when you see patients and you go on studying, then you become a doctor. MBBS is just a license given to you, that now you start practicing and studying medicine. So actual practicing and studying medicine starts after MBBS. Yeah. So that's it. So it's nothing to do with your academics.
Yeah. Also, I think there are so many fathers. I have heard of many stories from friends and colleagues where they came from nothing. They came to a city like Bombay, or they came to a city like Delhi, or they went to they went to settle in America or in the UK at the age of 20 with nothing in their pocket. They still talk about it. So 40, 50 years later, they still have that, like you said, we were talking about intergenerational trauma. Their trauma was, I came from nothing, I cleaned toilets, I did this, I drove a taxi, I earned money. I had nothing, we made different ends meet in whatever way possible. Now that also they pass on to their children.
Yeah, so you have to do it too. You understand?
Yeah, you have to do it too. If you're not dying, you're not doing a good job.
Yeah. So what the things that passes on, that to succeed, you need to struggle.
Yeah.
You understand? You need to struggle. So if you're doing something easily, if you're getting something easily, that's not,
It's not worth it.
yeah, it's not worth it.
Yeah.
That's not accomplishment.
So I think these are formulating ideas for your children for no reason.
Yes, and I'll tell you, I know one person like that who was exactly like this. He's a doctor. So when he came to Mumbai, okay, he was married and he had a child and he had to struggle, right?
Yeah.
And because of his struggle, and both the dad and mom both were doctors and both were struggling, and this kid was growing up with the help. You understand?
Yeah.
The house help. So what happened? The child got neglected.
Correct.
That now I'll tell you, neglect is the biggest trauma. It is more than sexual abuse. It is more than physical abuse.
Oh my God.
A child, okay, can't survive. The human child is the only child who can't survive. You understand? Any animals, after their babies are born, they go hunting, they go catching their prey, right?
Correct.
But a human child needs to be supported for a long time, 17, 18 years, right? So when a child is neglected, the child feels very unsafe, very scared,
Abandoned.
very abandoned. And this feeling of abandoned, goes on in life.
Yeah, I
And
think
this-
that's a huge, huge trauma.
Yes, and that is seen as fear of rejection. If they are rejected later on at the workplace, by their partners, it flares up. You got that? So neglect is something, a child can't bear.
Since our childhood paves the path to our adulthood and our thinking patterns and our core beliefs for life, could you tell us the relationship between childhood trauma and common mental health conditions?
They are related. They are connected. Okay. Now, let's pick up some mental health conditions like substance abuse. Okay.
Yeah.
Now, what happens? Someone gets addicted to a drug. What they do with them? They'll go to a rehab, admit them for 3 months, come back, and the person after some time starts again.
Yeah.
You must have seen that, right?
Correct.
Why does it happen? Because 90% of the substance use is because of childhood trauma. 90%.
Which childhood trauma is
Any childhood trauma. It can be neglect, it can be physical abuse, it can be emotional abuse. See, there are many childhood traumas, right? Okay? Like a mental health, say a schizophrenic in the house, okay, can be a trauma for a child.
Right.
You got that? Alcoholic father who drinks alcohol and comes home and does, is very aggressive, beats up. That's a childhood. Mother being beaten is a very big childhood trauma because a child is connected to the mom
Correct.
from the
He's
womb.
watching.
From the womb. And a mom being beaten is a trauma to the child. The child feels, oh my God, who's going to protect me?
Also, they feel they're in danger and their main caregiver is in danger.
Exactly. And then there's neglect, emotional abuse, physical abuse, sexual abuse, okay, community violence, right? Domestic violence. These are all,
Like you said,
examples of
something as
trauma.
simple as neglect
Neglect.
can lead
Yeah,
to
it's not
substance
simple,
abuse.
it's very severe.
No, I mean to say,
yeah.
for people just think, I didn't have the time, I'm a working professional, what can I do? I have to leave the child in a daycare, I have somebody at home looking after the child. There are many reasons we give ourselves with busy lives.
Exactly.
But like you said, it's actually not that simple, it's one of the biggest.
It's not that you have to leave your job and sit in the house, but you can find out a way so the child doesn't. See, it's about what the child is feeling.
Yeah.
It's not what you're doing. You might think, oh, I'm doing a lot for the child, right? But the child is feeling neglected. Then it's a problem. You got that?
Correct.
So, coming back to the mental illness, let's say substance abuse. When people have all this trauma as adult, lot of them start drugs, okay? They want their 10 minutes of happiness. Simple si baat hai. They want their 10 minutes of happiness and they go into drugs. So they are put into a rehab, they are given medications, and they come back. But the reason why they are, on the first hand, first place they started abusing drugs has not been addressed.
Yeah. It is
Got that?
deep-rooted, of course.
It is deep-rooted, so that has to be addressed. So then you see borderline personality disorders. Borderline personality disorders, okay, 80-90% of them are because of trauma in the childhood. Now, if you go on giving them medications, they are not going to get well. No, it's not a bipolar disorder. It's a personality disorder where there is, the person, has a change of affect, okay, they self-harm, they cut themselves.
Oh, right.
Yeah,
Okay.
you understand? So they are very fluctuating mood. Okay, this is borderline personality disorder and many other stuffs. This is something that has its roots in the childhood, in trauma, right? So narcissistic people,
Narcissistic
yeah,
people.
they have trauma in the childhood. They don't even know that. You got that? So for these people, therapy is very important. Only those therapies which are trauma informed. Not some talk therapy is not going to help them. Okay, like talk therapy is a top down approach. Like you tell something and that gets stored in your brain, right? But when the person is triggered, the upper brain shuts. It's the lower brain where the experiences
Yeah,
are
like you
stored.
said.
So that has to be addressed. Okay, so there are therapies for trauma, like psychodrama, for EMDR. These are meant for trauma, like somatic therapy. These are all for trauma, and that has to be addressed.
So, trauma obviously in our childhood will affect our attachment, right? How we attach to our parents, our grandparents, our friends, and then later on, our spouse, our colleagues. Can you tell us how it affects or regulates our attachment styles in life later on?
Okay, so you see, let's say a parent, okay, is sometimes available, sometimes not available. Okay, so as soon as the umbilical cord is cut, okay, the child is out, right? And what happens now? The child needs to be connected to the parent,
Correct.
right? And that comes in the form of hugs, that comes in the form of talking to the child, being with the child, all that. Now, say the parent is available sometimes, the parent is not available sometimes, okay? Sometimes they come and then for long hours they're gone. So when they're gone, the child is anxious. Where's my parent? Where's my caregiver? So they're trying to find, they become anxious. And again, the parent come back and they're happy. So now the child is always anxious. When will my mother go away again? When will my mother come again? So they develop an anxious attachment style. So as adults, they become clingy.
Oh, so
You understand?
yeah.
If they start liking somebody, they'll become clingy. They'll not let the other person go.
They won't let them breathe.
Yeah, they won't let them breathe. And let's say there's a relationship and it breaks off, that person will not allow the breakup to happen. You understand? Okay.
And then you start to think to yourself, this is psychotic.
Yeah, what's happening? I have people coming to me, no, our relation is not working. I want to separate, but she
Won't let go.
doesn't let me go. What to do? You understand?
But poor person is coming from their childhood trauma.
Exactly. So this clingy personality, comes from the childhood. Okay. Or it can be avoidant when the parent is not present for a long time. Okay. The child learns, okay, I have to learn, to deal without the parent. I must look after myself. And now as an adult, they'll push away people.
Yeah, they won't involve them only emotionally.
They'll want at one point, I want to get attached, I want to have a relationship, but at the same time, they will keep them at a distance. So this is going on. You understand? Yeah. And the partner will say, think what nonsense, ultimately
Hot,
they go
cold,
away.
hot, cold.
Yeah, hot, cold stuff, it's like that.
Wow, so interesting. We don't realize how much depth of our life lies in our childhood. And
The entire stuff.
yeah, like you said, it clearly all our patterns and our thought process and our core beliefs come from there. So can you tell us what role does timing play? In the sense, like, are certain developmental stages more vulnerable to specific types of trauma? Can you give us some examples?
See, as I told you, like for example, neglect. Okay. Now, caregiving is very important when the child is still, say, 11, till the child develops autonomy. You understand? So, at that point, if the child is neglected, it hurts the child a lot. But if a 17 years, 18 years, is kept alone in the... Like, let me give an example. Keeping a child alone in the house, say for a 6-year-old, that is more traumatic than for a 15-year-old.
Clearly, at 15 you have your personality.
Yeah. So you develop autonomy, you know how to take care of yourself.
Self.
So if the child is kept alone in the house, the child can manage. But if you keep a 6-year-old or 5-year-old locked up in the house and you're out for 5 hours, that's going to have a problem. Okay. So what age things are happening is very important.
Absolutely, I think resilience comes in as we grow.
Exactly.
So obviously the resilience is very low the younger we are.
Yeah. And see, like in teenage years, for example, this is the time we learn to make choices. Correct? As a child, we are not making so much of choices. Our parent makes our choices. But when you're 12 years, 13 years, or in the teenage years, you're starting to make choices for your life. Now, at that time, if a parent is making all the decisions, what you need to eat, what you need to wear, where you need to go, how you need to sit, okay, if the parent is making all the choices, the child does not learn to make choices.
Yeah.
Okay, and so this need to make choices is a very important thing for human beings. It is only the human beings who make choices. You understand? Animals don't make choices. They go by their sensations.
Correct.
A dog doesn't choose, should I sit here or not there, right?
Yeah.
On rational basis. They choose on basis of sensations, right? But it's only human beings who makes intellectual choices, rational choices. So if a teenager is not allowed to make choices, that person does not learn to make choices.
So then their decision making for their life becomes very poor.
Exactly. So in 20s, 30s, they are very scared of the world. Like I'll tell you something. Okay. I feel when a boy and a girl gets married, and they're planning to have children, I feel they should go through some parenting courses, and courses where they, also teach about trauma. See, two people get married and they have a child, right? And then now they raise the child based on what the parents are telling them.
Or on the traumas they have come from.
So all the information they're getting to raise the child is all backdated. So what was right for their parents may not be right in this generation.
And 30 years ago.
And 30 years ago. So things has to change, right?
Yeah.
Okay. So I think couples should read, something about parenting and trauma and how the developmental stages of children is important before they have a child.
So let's talk about coping mechanisms. And I think as human beings, we have certain coping mechanisms that come normally to us, naturally to us. And some obviously we develop through our family or our environment. Can you explain what are the common coping mechanisms for children who have experienced trauma?
See, when somebody is having a trauma, a child is always trying to survive.
Right.
That's the first thing. The child needs to survive. That's the most important thing for a child. So when there are, say for example, the parents are fighting, right? What does the child do to cope? They'll go and try to intervene. Tell dad, don't get angry, dad. Yeah. Tell the mom, don't fight. So what's happening? They are becoming a parent to the parent.
Correct.
In the childhood, they are supposed to go and play and explore and have fun, right?
Yeah.
And what they are doing, they have started parenting. And that's a burden for them, right? And now whole life they'll be going on doing this, parenting people around them, right? They've lost their childhood. So that's how they cope. They will do whatever it takes to survive in that moment.
What happens to children who have emotionally unavailable parents? How do they cope?
I'll give you an example, you'll understand.
And not physically unavailable, emotionally unavailable.
I know that. I'll tell you, I'll give you an example. So this mom, is separated from her husband, right? And this mom is very sad all the time, for the divorce. Not divorce, is separated, okay? And the grandfather is always telling the kid, your mom is sad, and you have to take care of mom, okay? And, you can't be naughty, you can't make your mom unhappy, you see, mom is always crying. So now this child is always trying to make the mom happy, make the mom smile, okay? And the child has suppressed his emotions. And the child has grown up, can't express emotions, he's numb. Whatever you ask him, he'll say, oh, everything is fine.
Yeah.
You understand? So that's how the child coped up, by suppressing his own emotions. He can't express, he doesn't know how to cry, doesn't know how to get angry.
Yeah, very interesting, because I feel what I have observed so far is emotionally unavailable parents leads to children who are also emotionally unavailable.
Yes, they suppress the emotion.
Yeah, because they don't know how to express it.
See, children, see monkey do.
Correct.
It's simple. What a child sees is what the child learned. If the child sees dad beating up mom, okay, there's a high chance, at least 50 to 60% chance of this guy will be abusive to his wife.
Correct.
Right? So they copy. they see how the environment is, and they learn that. So if they see, love is not something in the house, okay,
It's not important.
not
We
important,
survived.
not important to hug, not important to say I love you, they'll think, oh, all these expressions are useless. It doesn't make sense.
Yeah.
You got that? And thus, now when they get married, the wife will leave. That's how people pack up their bags and move out.
Yeah, because they've come from a different background, a different learning.
Yeah.
For them, let's say hugging, saying I love
Yeah,
you, and
exactly.
warmth was very normal.
Yeah.
They'll find this alien.
Yes, and now let's say a girl who grew up in a very supportive family, okay, gets married to a guy, okay, who was aloof and who was neglected and emotionally abused. There's going to be a lot of problem in this marriage. So one thing I say people, before you get married, just look if that other person had childhood trauma.
I think that's very hard to figure out. But I think now next generation obviously has the opportunity, because now people get to know each other. There's not that much of arranged marriage culture anymore. People get to know each other before. There is space for this to figure out what their childhood trauma was like, what their relationship with their parents is like, what their parents are like, because that environment will tell you what he has grown up as. But I think until our generation, we didn't really have a chance to get to know.
So, people only go and see horoscope. Okay, that's fine. You understand where their moons and stars were, all that. That's okay. But seeing the developmental years of the person is very important.
No, I think I think there's a high chance, and I'm nobody to, I don't have a professional view on this, but my view is that there's a high chance that even if 60% of the horoscopes were matching, 30% were probably divorced, based on environmental reasons, home environments, or personality reasons, or whatever it may be. So you're right, absolutely.
One of the reasons of divorce is trauma again. See, what is a relationship? Both bring something, right?
Yeah.
Now, if both have childhood trauma, okay, that's what they bring in their relationship.
Correct.
So how will it work? It will become toxic, no?
I think everyone needs to start working on themselves as soon as they realize.
That's the key. That's the most important thing.
Yeah.
When we start, see, I'm a psychiatrist, right? I also worked on myself. I also had a therapist.
Yeah.
You understand? It's not that I didn't have trauma. Yes, of course I had trauma. So unless I work on myself,
yeah.
how will I help others?
That's true.
Like in school, I was bullied, right? So if I don't work on my trauma of getting bullied, so when a patient comes and that person is bullied, that will trigger me. How can I help the person?
Wow.
So every mental professional must work on themselves. This is, before getting your degrees, you work on yourself. Like whoever comes to me, like for internship or something, I tell them, all this is fine, start working on yourself. Every psychiatrist, every psychologist, okay, must work on themselves. They must go for therapy.
Yeah, I think.
It's very important. And I'll tell you, yoga, meditation is very therapeutic.
Yeah.
Yoga and meditations, like especially mindfulness meditation, okay, and yoga, they're very therapeutic for trauma. People who have trauma, they have a body-mind disintegration. The body and mind is separated. You understand? So they feel numb in their body. So when they do yoga, when they do meditation, right, the integration happens. And even martial arts. I tell so many of my patients to go and learn martial arts, people who are trauma, and you will not believe that improvement they have.
Wow.
Okay, so martial arts, yoga, dancing, these are very therapeutic.
So there's a very interesting term, emotional abuse. I don't think people understand it very accurately. I think it's used loosely, as well as people use it incorrectly. Can you tell our listeners, as a professional, what exactly is emotional abuse? What covers emotional abuse?
Okay, emotional abuse is abuse where the authentic emotions are not allowed to be expressed, right? For example, girls can't be angry. You understand?
Boys can't cry.
Boys can't cry. Okay, that's nonsense. You understand? You can't be fearful. You have to be a brave boy. Okay, how can you be fearful? That's emotional abuse. When a kid, is humiliated in public, a lot of people say, oh, you are not good in studies, and what will you do? You have to, become a rickshawala or something. You understand? And they're compared with others. There's another emotional abuse. You are not good enough. See, that other kid is much better than you. What are you telling your kid? You are not capable. You cannot survive.
This is emotional.
This world is too hard for you, too difficult for you. These are all emotional abuse. Where you break the confidence of the child. You got that?
Yeah.
So these are all kinds of emotional abuse. Embarrassing, comparing, humiliating a child, saying, you can't express your emotions. Don't cry. Why are you crying? You're not supposed to cry. These are all different kinds of emotional abuse. And then what happens? But the parent, they say, see, we have done so much for you. We have given you this, we have given you a good school, we have given you all the clothes. So they think love is giving things.
Providing.
Is providing.
Yeah.
So yes, parents can be good provider, but they may not be emotionally available. Okay? So that is an emotional abuse.
Isn't providing job of a parent? Like, I feel like if I have brought my child into this world, it is my duty to provide. I'm not doing the child a favor.
Yes, the child does not come to this world with his or her consent, right?
Correct.
Okay. So of course you have to provide. You are responsible for raising the child. Okay.
Right.
So providing does not mean you have done a great thing, but being emotionally available, teaching the child, to stand on their own feet, make decisions. You understand? Being accountable of things. These are the things that need to be taught, more than what's written in the books.
I think another form of trauma which I have read about and I have observed is losing a parent or losing a loved one. So it could be losing a sibling very young, could be losing a parent very young, could be losing a grandparent who was your prime caregiver. How do you approach helping children with such kind of a trauma?
Yeah. So you see, when someone dies at home, okay, lot of kids, are not told about it.
Yeah.
Right? They are, as I told you before, the children, their brain is not developed, so they have to be helped to process it. Right? So now they don't know what death means. A 2-year, 3-year-old doesn't know what death means. Right?
I think even at 5 they don't know.
Yeah. So now there's a grandfather with whom the child is very attached, and the child feels loved. And one day suddenly the child sees the grandfather is lying and everybody is crying. So what happens to a child? When everybody is crying, the child is confused. There's a confusion of emotions. There's a conflict of emotions. The child doesn't know what's happened to the grandfather, why everyone is crying, okay? Yeah. And when the child asks somebody, no, you be away from it. Nothing happened, go.
You go and play outside.
Go play outside. Okay, the child is all with questions. So when the child grows up, they feel betrayed. They feel not told.
Yeah,
right?
That's again a trauma.
It's a trauma. And they can be angry on the grandfather for leaving him. There's another, being abandoned.
Yeah.
I have seen patients who, I'll tell you, this kid, lost his father when he was 7 years old. Okay, and he missed his father, and when he came to me, he was about 35 years old. Okay, and he always missed his father, and because he couldn't say goodbye. He was in school, and his father expired in the hospital, and he couldn't say goodbye, and he was angry. You understand?
Yeah.
Because it was an unfinished business.
Yeah, he didn't get closure.
He didn't get a closure, right? And he was angry on his father for leaving him. Okay, how could he die?
So at 35, he came seeking counseling for...
Yeah, and he came for other things, but this also came up.
Right? He must have not even realized.
He never even realized. And what happens, when you don't address the child goes into fantasy. Okay, now this guy's father had a road traffic accident. Okay, so he was not explained, he was not told anything. So what did he fantasize? My dad must have been a rash driver, or he must have drunk, and that's why the accident happened. And that's all the stories he made up in his mind, which was not true. So when the child is not informed, we think, the child is small, the child will not understand. That's the very reason you have to make the child understand.
Correct, because otherwise they'll make up their own stories and then it will remain till adulthood.
So it becomes a fantasized trauma. You understand? So something happened, you have not explained the child what happens because you think the child will not understand, and the child has made up his own story behind that event. Yeah. And that becomes the truth for the child.
Yeah, I think a lot of what we remember from our childhood, which may or may not be true, actually becomes our truth.
Yes, exactly. And the child is living with that fantasy, you know. So this is very important to address.
So, how do you help these children or these adults who have gone through these things?
Well, in such cases, you know, so psychodrama is a very specialized therapy. According to me, it's the best of all the therapies that I do.
For treating trauma.
Treating trauma, any issues, but especially for trauma, psychodrama is the best. Okay, it gives the best result for me, right? So psychodrama is like, you know, something that happened in the childhood, say something happened, and the body was asking you to take an action. So there was a trauma that happened in action. So let's say a child was bullied in school, right? And the child was small and he couldn't stand up for himself, right? So that was an unfinished business, right? And that goes on with the child. That feeling of being bullied, being controlled, okay, that goes on even in the adulthood. So in psychodrama, what happens? We recreate that. We, you know, they enact that scene where that person, you know, goes back into the childhood and takes the action that he could not take it then.
He's able to relive it, that
Relive
moment.
it, yeah, with the safety of the therapeutic stage, you know, like, and that is completely healing. That
Wow.
just goes.
That's amazing.
So there was this girl who was sexually abused as a kid by her tuition teacher, right? Now, two things happened. She went and told her mom. What did the mom say? Don't tell this to anybody.
Bring
Okay,
shame.
it will bring shame,
Yeah.
right? Don't this. Okay, you don't have to go to that tuition, but don't tell this to anybody. What happened to the child? Okay, she was, and when the child was molested, she didn't understand all that. She was just 6, 7 years old. Okay, so okay, fine. But when the child grew up to 13, 14 years, she remembered what happened. You understand?
Correct.
So now this has become a trauma. You got that? And the child, two things happened. One, the child was angry on the teacher for doing this, and the child was angry on the mom for not standing up for her.
Correct.
You understand?
Yeah.
So there was two trauma with this event. So when we did this psychodrama, you know, she took out her anger on her mom and she confronted the mom. You know, you did not support me. You know, and there is something called role reversal where she, you know, she talks to the mom, you know, she takes the mom's role. There's a lot of complex stuff, okay? And she beat up the teacher.
She's able to let go of that
It's
emotion.
not imagine, she does it in action. They
Yeah,
do
because
it
she's
in
holding on to it for so many years.
So, you know, just imagining it will not help, or talking about it will not help. You have to do it in action. So, what start in, see, psychodrama was invented by a psychiatrist. His name was J.L. Modino, 100 years back, okay? And he says what starts in action must be completed in action.
Right.
You understand? Because the trauma happened in action. So we must again go into action and enact that.
Complete the circle.
And complete the circle, and that is healing. That is therapeutic. So, you know, like psychodrama is just amazing.
So I would like to end the episode with you telling our listeners about the importance of the childhood journey and how not to create a hostile environment for children of the next generation.
Okay, so just see your child, okay? The best way to know what's happening to a child is observing the child. Is the child happy? Can the child express? Okay? Is the child fearful, getting angry? So if you see these emotions in the child, it may be the child is depressed, because depression in children is manifested with anger, right? They can be irritable, they can be angry, then that's a sign of depression. So when that happens, two things need to be done. Not only to treat the child, but also to see what I am doing wrong, what is not right that I am doing that is causing the child these problems. So if one does that, it's really, really, things become better and better.
I think it's so important from what you've said to, the best takeaway I feel from everything you've told us is whatever we could not correct for ourselves, we must correct for the next generation. whatever we didn't understand about ourselves, we must understand from the next generation and not carry our trauma forward to them.
Yes. So the parents need to work on themselves, not only for themselves, their life will become better if they do that,
Correct.
but it is also for the children.
Absolutely. Thank you so much. It has been a great pleasure having you here and this deep knowledge of childhood trauma, Dr. Ghosh. Thank you for being on the show.
Thank you.
This has been the Therapy Diaries. Please take care of yourselves and each other.